Vanakkam, good morning. In this video, we are going to discuss about the physiological actions of the insulin. This is an important short note from the endocrine physiology. Physiological actions of insulin. Insulin mainly act on the carbohydrate metabolism. The main aim of the insulin is reduce the blood glucose level. In the liver, the insulin facilitate the entry of the glucose into the hepatic cell by the enzyme glucokinase. It converts the glucose to the glucose 6 phosphate. It is also insulin also stimulate the glycolysis. Here glucose is converted to pyruvic acid and lactic acid by the enzyme phosphofructokinase and pyruvate kinase. Then the pyruvate lactate are oxidized by the pyruvate dehydrogenase. The insulin also promote the glycogen synthesis from the glucose by the enzyme glycogen synthase. The insulin inhibit the glycogenolysis, convert the glycogen to the glucose by inhibit the enzyme glycogen phosphorylase glucose 6 phosphatase. It is also inhibit the gluconeogenesis by the inhibit the enzymes pyruvate carboxylase phosphopenol pyruvate carboxy kinase. In the adipose tissue, the entry of the glucose into the adipose tissue by the glucose transporter 4 and hexokinase activity. Here glucose is converted to the alboglycerophosphate. Alboglycerophosphate is used for the esterification of the fatty acids, and glucose is stored as the triglyceride. In the skeletal muscle, glucose transport is facilitated by the insulin by GLUT4 transporter and hexokinase activity. The glucose is oxidized in the skeletal muscle by the pyruvate dehydrogenase, and glucose is stored in the skeletal muscle as a muscle glycogen. So ultimately the plasma glucose level is decreased due to the utilized sugar is utilized by the skeletal muscle adipose tissue liver. So they utilize the sugar and stored as the triglyceride glycogen, inhibit the glycogenolysis, inhibit the gluconeogenesis. Actions of insulin on lipid metabolism. In the adipose tissue, insulin is important for the storage of the fat. The glucose is converted to the triglycerides by alboglycerophosphate, and esterification of the fatty acid occur. It store the fat. It inhibit the lipolysis by inhibiting the enzyme hormone sensitive lipase. And insulin is important for the lipogenesis. So triglyceride directly does not enter into the adipose tissue. So triglyceride is converted to fatty acid by the lipoprotein lipase present in the vascular endothelium. That fatty acid enter into the adipose tissue. It's stored as the triglycerides. In the liver, insulin is convert the acetyl CoA to the malonyl CoA by acetyl CoA carboxylase. The malonyl CoA is important for the inhibiting the carnitine acyl transferase. Carnitine acyl transferase is helpful for the conversion of the fatty acid to keto acids. So So insulin is inhibit the carnitine acyl transferase by overproduction of the malonyl CoA. So it inhibit the keto acid formation and fatty acid synthesis by increased production of the activation of the HMP shunt, hexose monophosphate shunt, increase HMC CoA reductase, that is important for the cholesterol metabolism, cholesterol production, and fatty acid synthesis. These are helpful to fatty acid synthesis. So the insulin on the lipid metabolism inhibit the lipolysis and lipogenesis, store the fat in the adipose tissue and inhibit the formation of the keto acids. The insulin acts on protein metabolism. Insulin is the anabolic hormone. It increases the protein synthesis, inhibit the proteolysis. The plasma potassium concentration is regulated by the insulin. Insulin facilitates the movement of the potassium from the plasma to the cell. Move the potassium from the plasma to the cell. So it regulate the plasma potassium level. So in the hyperkalemia, we routinely give the insulin drip for the treatment of the hyperkalemia. So regulate the plasma potassium level, and it is also move the phosphate mechanism into the cell. In the renal tubule, sodium potassium phosphate is reabsorbed due to the insulin. The insulin is decreases the food intake by inhibit the neuropeptide Y release from the hypothalamus. The chronic insulin excess increases the body weight, and it is also important for the growth. It is promote the release of the insulin growth factor 1. It is the promote the growth of the cartilage and bones. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed this channel, please subscribe. This video briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.